Welcome to today's video, where we'll be discussing a rare and often overlooked condition called Plummer-Vinson syndrome, also known as Paterson-Kelly syndrome or sideropenic dysphagia. This syndrome primarily affects the upper digestive tract and is characterized by a triad of iron deficiency anemia, dysphagia, and esophageal webs. Join us as we delve deeper into the causes, symptoms, diagnosis, and management of this fascinating and complex disorder. The exact cause of Plummer-Vinson syndrome remains elusive, but iron deficiency is almost universally present and is thought to play a central role. Other contributing factors may include genetic predisposition, nutritional deficiencies beyond iron, and autoimmune disorders. Some researchers suspect a link to upper alimentary tract malignancies, making early diagnosis and monitoring crucial. It's important to note that while iron deficiency is a common finding, it alone isn't sufficient to cause the full syndrome. There appears to be a combination of factors at play that predispose individuals to developing Plummer-Vinson. The pathophysiology of Plummer-Vinson syndrome is complex and involves several key components. Iron deficiency leads to impaired production of hemoglobin, the oxygen-carrying molecule in red blood cells, resulting in anemia. This anemia contributes to mucosal atrophy, particularly in the upper digestive tract. The most characteristic feature is the formation of thin web-like membranes in the esophagus, predominantly in the upper portion. These esophageal webs physically obstruct the passage of food, leading to dysphagia, or difficulty swallowing. The exact mechanism behind web formation is still being investigated, but it's believed to be related to chronic inflammation and impaired cell growth due to iron deficiency. Long-standing iron deficiency can also affect the cells of the tongue and oral mucosa, leading to glossitis, inflammation of the tongue, and chylosis, cracking at the corners of the mouth. Plummer-Vinson syndrome is a relatively rare condition, with its prevalence significantly decreasing over time, particularly in developed countries. This decline is largely attributed to improved nutrition and iron supplementation. Historically, the syndrome was more commonly seen in Scandinavian countries and among women of childbearing age. Current epidemiological data suggests that it affects primarily postmenopausal women and individuals with chronic iron deficiency. However, it can occur in anyone with prolonged and severe iron deficiency, regardless of age or gender. It is important to remember that even though it is rare, awareness of this syndrome is crucial for early detection and management. The signs and symptoms of Plummer-Vinson syndrome are varied and can significantly impact a person's quality of life. The most common symptom is dysphagia or difficulty swallowing, especially with solid foods. Patients may describe a sensation of food getting stuck in their throat. Other symptoms include fatigue and weakness due to iron deficiency anemia, a pale complexion, brittle nails, a smooth, sore tongue, a glossitis, cracks at the corners of the mouth, a chylosis, and sometimes an enlarged spleen. In some cases, patients may also experience weight loss due to the difficulty in eating. These symptoms can develop gradually over time, making early recognition challenging. Diagnosing Plummer-Vinson syndrome involves a combination of clinical evaluation and diagnostic testing. A thorough medical history and physical examination are essential. Blood tests are performed to assess iron levels, hemoglobin, and red blood cell indices, typically revealing iron deficiency anemia. The key diagnostic procedure is an upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus to visualize the esophageal lining. This allows for direct observation of the characteristic esophageal webs. Biopsies of the esophageal tissue may be taken to rule out other conditions and to evaluate for any signs of malignancy. Barium swallow studies can also be used to visualize the esophagus, but they are less sensitive than endoscopy for detecting subtle esophageal webs. Plummer-Vinson syndrome isn't typically classified into distinct types. However, the severity of the syndrome can vary depending on the extent of the esophageal webs and the degree of iron deficiency anemia. In some cases, the webs may be small and cause only mild dysphagia, while in others, they can be more extensive and significantly impede swallowing. Similarly, the anemia can range from mild to severe, impacting the patient's overall health and well-being. The focus remains on identifying and addressing all components of the syndrome, regardless of the specific presentation. The primary goals of treatment for Plummer-Vinson syndrome are to correct the iron deficiency and alleviate the dysphagia caused by esophageal webs. Iron supplementation, usually in the form of oral iron tablets, is the cornerstone of treatment. In severe cases, intravenous iron infusions may be necessary. To address the esophageal webs, endoscopic dilation is typically performed. This involves gently stretching the webs using specialized instruments passed through the endoscope, effectively widening the esophageal passage and improving swallowing. Monitoring for potential complications, such as esophageal perforation, is essential during and after the dilation procedure. In addition to these specific treatments, nutritional counseling and dietary modifications may be recommended to ensure adequate intake of iron-rich foods. Preventing Plummer-Vinson syndrome primarily focuses on preventing and treating iron deficiency. This includes ensuring a balanced diet rich in iron-containing foods, such as red meat, poultry, fish, beans, and leafy green vegetables. For individuals at higher risk of iron deficiency, such as pregnant women, menstruating women, and individuals with certain medical conditions, iron supplementation may be recommended. Early detection and treatment of iron deficiency are crucial in preventing the development of Plummer-Vinson syndrome. Regular medical check-ups and blood tests can help identify iron deficiency before it progresses to more severe complications. The prognosis for Plummer-Vinson syndrome is generally good with timely diagnosis and appropriate treatment. Iron supplementation typically resolves the anemia and associated symptoms. Endoscopic dilation effectively alleviates the dysphagia caused by esophageal webs. However, long-term follow-up is essential, as there is an increased risk of developing squamous cell carcinoma of the esophagus and oropharynx in individuals with a history of Plummer-Vinson syndrome. Regular endoscopic surveillance may be recommended to monitor for any signs of malignancy. Recent research has focused on identifying the genetic and molecular mechanisms underlying Plummer-Vinson syndrome, which may lead to the development of more targeted and effective therapies in the future. Furthermore, there is ongoing investigation into the role of the microbiome and its potential impact on iron absorption and overall digestive health in these patients.